My dad was one of the first haulers of uranium in this area. So as a young kid, I had the best sand piles you could ask for. Just acres of high-grade uranium sand is about what it amounted to.
There was only 2 jobs in this whole region that paid anything, and that was the atomic plant or it was a railroad. Everything we had was dependent on that.
I went from $1.85 to $3.55 starting out, and we could afford hamburger meat then.
Kids, they didn't want to finish high school because they'd go out in the ore patch and make money.
I had just gotten married, and I went to work there in the uranium mine, and at the time, I didn't think too much of it.
I mean, you didn't know a whole lot about the problems that it could cause. And people that had been there forever, they said, oh, you don't have to worry about this stuff. Said, you can eat it. It won't hurt you.
Where we were working out there, the old yellow cake was so hot that it actually spun the needles off of 2 Geiger counters.
Early, I wasn't worried about my health much, but I got into hazardous materials response, and that's when I found out all the different hazards that were out there, not just the uranium hexafluoride, but just about everything out there was dangerous in some way.
This is a generation that worked hard. They went to work their whole life. They provided for their family. They didn't ask for help. They still don't want to ask for help. And a lot of them feel like there's nothing wrong with them. They're healthy. They're doing fine. You hear that a lot, I'm fine. But they may have chronic conditions that they've lived with that are getting progressively worse.
These folks gave a material part of their physical health up for the service of their nation, whether that was uranium mining or whether that was working in nuclear weapons facilities.
You work in uranium, you inhale uranium dust, which is radioactive, and it tends to scar the lungs. And so then your lungs don't oxygenate well.
They have what I consider really to be one of the worst disease progressions that you can have, and that's a respiratory disease progression. They have diseases that are chronically debilitating.
We got to testing and doing lung tests and found out that the chemicals that I was exposed to at the plant were responsible for the lung problems that I'm having. And one of the guys at the pulmonologist said, "You worked at the plant, didn't you?" I said, "Yeah." He said, "You know, there's people that will help you with this."
I grew up in this community, like right beside the plant, and now I actually get to help them get these medical benefits and other care.
At United Energy Workers Healthcare, it is our privilege to serve former energy workers in their home.
We serve about 2,500 patients in 28 states across 36 offices.
From Paducah to Waverly, Ohio, to Aiken, South Carolina, Richland, Washington, to small places like Blanding, Utah, Espanola, New Mexico. We work and live in the same communities as they do.
And we do 2 things. We provide a lot of love in these homes, and we wrap our arms around these patients. And we also deliver outcomes-based healthcare to improve their quality of life.
The program exists because the government has acknowledged that they have a hand in this. And they want these people to be treated fairly, and they want them to get the health care that they need to live the longest, happiest life they can.
It helps current and former workers pay for their medical benefits.
When a patient comes on services with us, we provide home health aid as well as nursing services. The majority of our home health aides are actually family member caregivers.
Your spouse, your family member, your caregiver, who's already engaged in taking care of every day, actually has the ability to be paid for doing that.
Evelyn, my wife, is my home health aide, and she takes over where Leslie can't be here all the time.
And I was all for it because I had retired. I worked part-time. I was self-employed. I had no pension. I had no benefits. And this is like an extra job for me that I would be doing anyway.
They set me up as a home health assistant for Becky, and that allowed me a little bit of the financial part of it so that I could go ahead and fully retire and be here with her.
And everybody wants to be independent, but sometimes you need some help.
One of the things that we're good at UEW is giving impeccable home care.
A lot of these patients aren't able to leave their home, and so us being able to go to them is ideal.
You get to go into their home, you get to see what they really need, you get to listen to them, you get to spend the time with them and get to know them like family. That's how a lot of them consider us and how I think myself and a lot of the other nurses consider them.
I think the benefits of in-home care is You've got everything that is yours with you, and they're there to help you. It's like almost like a family unit when you get used to them.
And we truly like to invite you into our family and treat you as our own.
Because of that relationship, it allows us to catch things early. It allows us to keep them at home.
They're in their home with their family. We let the family members be the family members. We come in and help you feel better.
We're happy. That's what it means, happiness and well-being, and knowing that your needs are going to be met if you need it.
I am able to provide the care for Miss Lee that I've always wanted to provide.
And I love her to death.
These ladies that take care of me are doing an excellent job. I told somebody yesterday I've been waited on more than I ever have been in my life. You couldn't go to a 5-star restaurant and get better service than I'm getting here.
I was having trouble getting up one day, and Hillary was out here, and she said, "You need a lift chair." I thought, yeah, I probably do, but I don't think I'll get one. It wasn't too long, but here come me a lift chair.
Whatever it is that you need to make life easier, we can coordinate all of that between a CNA, an RN, and a case manager.
And what I can promise you is that no one will advocate for you more than we will. Nobody will surround you with resources the way that we will.
I'm very thankful for this program because there's some wonderful people that's helped me tremendously. My case manager, she goes to the doctors with me, and she understands what they're saying when I don't.
You're getting so much information from so many different places that our nurses and case managers really work to tie all that together for them and help improve their quality of life.
There for a while, he was giving up. He says, "I don't want to live, I want to go."
They have helped me adjust to a way of life that I don't know how I would have adjusted to without them.
It's helping to prolong their quality of life and their dignity and their ability to live their life in the way that they wish to.
The riding is part of what keeps me going. And I carry my portables on the bikes. Those were a godsend.
He just started to live again.
I feel very blessed to have the 2 caseworkers I have. They're very good. They're caring. You know, it's not just a job. It's a calling.
My life is better. Miss Lee tells me all the time that her life is so much better to be able to have somebody that she can depend on and rely on, and someone that comes in and treats her like family. Sitting there drinking coffee in the mornings and having breakfast and reading the paper together, it sums it up that both of our lives are so much better because we're connected through United Energy Workers.
Let us partner with you to help you live a longer, happier, healthier life. And most importantly, to do it in the comfort of your home, surrounded by the people that love you most.
Don't put it off. You got a chance, you know, for super help that you're not going to find anywhere else. It's one of the best things that has happened to me.